diet and getting various immune treatment. There's another theory that supports chelation therapy. The idea there is that it's removing toxins. It's similar to plasmapheresis. Put the blood through a filter and then return the blood to the child after it's been filtered through. The idea is you're removing, maybe they've got harmful circulating antibodies to their own tissues. And so what the plasmapheresis does is it removes those antibodies. It's sort of a shot in the dark. We don't know exactly what's being removed, and it requires many, many, many treatments. And again, it's a very subjective assessment as to who gets better from this. Now, I did want to make a point here that chelation is not effective for mercury that's in the brain. Because like I said, once it's in the brain, it cannot cross the blood-brain barrier to get out again.
Wow.
Right. Now, some researchers are encouraging the use of special diets, especially dietary restriction. One idea is that there is, I guess we're still on this slide, there is that these children are not breaking down the proteins in their food correctly. And so large undigested proteins get across into the blood. And then they get recognized, excuse me, as foreign bodies. And it provokes the immune system to start attacking. And as they fall out, it sort of attacks the normal tissues. That's all theory, but it does seem to support the idea that if they give these kids like maybe a gluten-free diet or something like that, or treat them for leaky gut syndrome, that their brain function might improve. And like I said, there's tons of individual reports. There are programs in certain areas of the country that have selected their patients very carefully and can show some results, but the results in the scientific literature in terms of large controlled studies just are not there yet. But then there's behavioral approaches, and this has really been the mainstay of how to handle an autistic kid before drugs got involved. And there's two main areas that are focused on. One is helping the child develop social skills. And the other is just trying to get him to minimize behaviors that are not functional. So one, you're really promoting skills you want them to learn, and the other, you're trying to sort of distract him from or redirect him from or suppress abnormal behaviors. So the goals here are really to engage the child in successful communication. Give him social skills, give him living skills, and many children with intense behavioral approaches are actually able to become successful students to a greater or lesser degree. Are you still hearing me out there?
Yep, I still hear you, Moira.
Okay. Okay, good. I just heard, it kind of went quiet on your end. I wanted to make sure. Okay, good. So, you know, these behavioral approaches, any parent who does any research, and again, I hope the presenter on Thursday goes into more detail on this, there are lots of programs that are very intense and have had tremendous success, but like I said, because they're not being funded by any big Eli Lilly, you know, they're just not getting the study that they deserve. And it's really up to the individual parent to say, I don't want to go the drug route. I know that my kid, you know, what I always say to parents is first do no harm. And, you know, doctors do not routinely take the Hippocratic Oath anymore, and haven't for many decades, actually. It's not even a requirement in most medical schools.
Well, what do you mean that they don't raise their right hand and swear to it anymore?
No, no. And the oath has actually been altered and perverted in various ways throughout the years. And so there's various altered versions of the Hippocratic Oath here and there, but the vast majority of medical schools in the United States, there's no convocation or official ceremony where graduating doctors actually take the Hippocratic Oath. But, you know, the parent should really abide by the guideline to first do no harm and look at their kid and just look at, okay, what wouldn't harm the child? And again, when you're looking at the risk-benefit ratio, you really owe it to the child to get a thorough education on the potential adverse effects of drugs especially common mental effects and long-term brain-altering effects before you agree to go that route. So this is really all I had on autism. I really want to, what I really wanted to impart was really beware this broad autism spectrum diagnosis, especially Asperger's. And secondly, really beware drug treatment. And there are other modalities out there that really don't have a tremendous amount of science behind proving them, but do have a lot of biological plausibility that they should and could work. And so I hope to give some parents of autistic kids some hope in that regard. And like I said, the Thursday presentation should enlighten us more on that. And this is really the exact thing that SmartMed Info is all about, is finding out what your doctor may not know or may not be telling you. Because unless somebody does the type of research that I've done, I doubt they would know this. I mean, I came into this as your usual educated physician. We've all heard about autism, and I thought something wrong with the brain. I thought there was tests for it, and I thought there was specific treatment. Come to find out, nothing of the sort on all three counts. No specific diagnosis, no definite tests, and no logical drug treatment. However, help is available for autistic kids in terms of these behavioral modalities, and then exploring other treatments that do not carry with them the dire side effects that can come along with drug treatments. So do we have any questions?
Sure, absolutely. Folks, just as a reminder, please remember that you can type in the questions in the panel to your right. And again, thank you, Moria, for a great presentation. Yes, you're right. Dr. Owings, Elizabeth Owings, is going to be doing a presentation that really tries to narrow in on the other modalities that probably don't have as much recognition as the pharmaceutical companies do, but like you said, are plausible and seem to be having some great results. And I think from my discussions with her, she's going to be talking about some of the research findings by a specific company called the Pfeiffer Institute in Chicago, and I think it has another branch in Minnesota, where they'll be looking at nutritional approaches and the biochemical imbalances and how nutrition can address these biochemical imbalances in the brain. So that should be a great, and I'm hoping that you will be able to join us on Thursday. I know you'll be busy for the first half of the presentation, but anytime you can join us, that would be great. So that's
I'll definitely plan on that. Yes.
Okay, and I'm sure you guys will be able to bounce off each other a lot more than I could, because you're both so knowledgeable about this. One of our presentations, and the questions are beginning to come in, so folks, just keep tapping the questions. One of our presentations on detoxification, that was by Rick Deitch. He's a biochemist, and what he said, or some of the research that they're finding out, is that some of these kids who may be labeled autistic or have other brain challenges, is that they have a genetic predisposition to slow excretion or slow handling of toxins as compared with other children, and that's why those toxins are not removed quickly, and they tend to build in the blood and in the nervous system. And so he said, and what he was talking about as an effective detoxifier was a compound called zeolites. I mentioned this at the beginning of the webinar. These are minerals that actually trap the toxins like heavy mercury and lead, and help your body excrete them naturally, harmlessly, without any complications. So, and I mentioned that, like I said at the beginning of the webinar, that's something that may help with kids in addition to the nutritional approaches. Have you ever come across any kind of research like that shows that some kids are slow excretors?
Yes, definitely. That is the main theory regarding, their tendency to have these toxins, especially since a lot of these behaviors are not discovered until the child is between 2 and 5 years old. So it does seem like there is a window of opportunity there, because it seems very probable that something is accumulating when you look at that time frame of things. So that theory is definitely supported. It's biologically plausible, and especially when it has to do with nothing invasive, and all they have to do is actually take a supplement and be on a special, dietary program, that is very worth aggressively pursuing and giving it a really good, very strict, aggressive try for the benefit of the child. It's definitely worth a try. I know various people who have actually undergone all different kinds of detox programs. And again, there's remarkable case reports. It's very hard to do a study that will, qualify for,